Let us discuss about Ligamenta Denticulata. What are Ligamenta Denticulata? If you recollect, there are three coverings for the spinal cord. They are the outer dura mater, middle arachnoid mater, and innermost pia mater, which is closely investing the spinal cord. And there are certain modifications of which you have read. So the four modifications of pia mater are the linea splendens, the Ligamenta Denticulata, spinal subarachnoid septum, and phylum terminale. Now we will discuss about this Ligamenta Denticulata. If you see in this picture, what you are seeing is the brain or cerebrum with cerebellar hemispheres and the spinal cord, which is covered by the three coverings. The innermost covering, which you can see in this picture of a ventral aspect of the spinal cord, which you can identify by identifying this anterior median fissure, which contains one of the modifications of pia mater known as the linea splendens you are seeing. Along with that, you can see the anterior spinal vessels. And if you go laterally, you are seeing the ventral and dorsal roots that are getting attached to the spinal cord and going towards the intervertebral foramen to become the mixed spinal nerve. And you can see laterally the triangular extensions from the pia mater between the ventral and dorsal roots, triangular or tent-like extensions you are seeing. They are the Ligamenta Denticulata. And if you see in this cut section of the spinal cord, you can identify the central gray matter, peripheral white matter, and the three coverings of the spinal cord starting from pia, the arachnoid with subarachnoid space between the two, and the dura mater you are seeing with the ventral and dorsal roots and mixed spinal nerve. You can see these orange colored thickenings. They are modifications of the pia mater. The anterior median fissure, this is the linea splendens, and in the posterior median septum, this is the subarachnoid septum, and laterally you are seeing the paired Ligamenta Denticulata. So Ligamentum Denticulatum is singular and Ligamenta Denticulata is plural. Then if you see in this picture, this is also the ventral view of the spinal cord. You can see the ventral roots and dorsal roots, and you can identify the dorsal root ganglion also. So the coronary oriented pile sheet you can see here shown by the arrows. These are the Ligamenta Denticulata. So these are bilateral extensions of pia mater between the ventral and dorsal roots, and they are about 21 pairs, and they are teeth-like processes, and they are attached to the inner surface of the dura mater, and they extend from foramen magnum to L1 vertebra. You will see it. So in this picture also you can see them clearly. These are the Ligamenta Denticulata you are seeing. Okay, and this is the linea splendens which I have mentioned. Now you can see in this diagram what are Ligamenta Denticulata. You can see those tent-like extensions you are seeing, and this is the dorsal view. You are seeing the posterior median sulcus you are seeing, where it contains the subarachnoid septum, one of the modification of pia mater. So the first tooth-like process of Ligamentum denticulatum will be seen at the level of foramen magnum between the vertebral artery, that is the fourth part of vertebral artery anteriorly, and the spinal accessory nerve posteriorly. The last tooth, pair of tooth, it is an oblique extension and it is like a fork. Okay, forked Ligamenta Denticulata they are called. They are between the roots of T12 above and L1 below. So these are the Ligamenta Denticulata you are seeing, and this is the from the lateral view. Here also you can see the Ligamenta Denticulata you are seeing between the ventral and dorsal roots you are seeing them. And why we should. Now let us see what is the clinical importance of Ligamenta Denticulata, and they are important during spinal surgeries that is the craniovertebral junction surgeries, for example in Cherry malformations and atlantoaxial malformations and basilar invaginations. They are important for the neurosurgeon also. If you see in this picture, you are seeing the cut section of spinal cord showing the various tracks that are ascending and descending. So this side in relation with the ascending tracks which are shown in blue color or labeled, and this side the descending tracks which are shown in orange color or labeled. For the neurosurgeon, for performing tractotomy, that is selective tractotomy, to relieve the pain sensations which could not be relieved by any other method, then they do stereotactic spinal tractotomy, taking the guidance of the ligamenta denticulata, which are shown in the dark line here. These are the triangular ligamenta denticulata. You can identify. For the neurosurgeon, these are the anatomical reference points for approaching the appropriate tract which they want to do the surgical intervention. So this is an anatomical reference point for accurate location of the spinal pathways and for division of the anterior and posterior compartments in the cordotomy, and they are stabilizing the spinal cord and they are keeping it in position so that the neurosurgeon will be facilitated for performing the surgical procedures. Now answer the MCQ. All the following statements are true about Ligamenta denticulata except one is they are modifications of pia mater. They extend from foramen magnum to L1 vertebra. They are 22 pairs. They stabilize the spinal cord. So which is the correct response? The correct response is C. That is there are 22 pairs, which is a wrong answer, and there are 21 pairs.